A deep sigh. Oh, excellent. Right, good morning, everyone. Welcome to the public session of the Oversight and Engagement Board for today, the 16th of October, apologies for the late start, 10:39. We had quite a long debate in our private session, which ran over necessarily. So apologies for anyone who was expecting us to start at 10:15, but we have now begun. So I'm going to go to the minutes from the previous meeting of the 1st of October, and I assume that everyone is happy with those, unless somebody has got any points to raise on that. I'm looking around the room. No, who's got any points to raise? Good, excellent, thank you. So I come to item 11, which is the summary of the local surveillance data, and to Lucy Whiteman, our Director of Public Health. Thank you, Lucy.
Councillor Morrison, good morning, everybody. So people will obviously remember that the data in the surveillance report is always around a week out of date because we've moved this week's meeting. It means that actually a new surveillance report will be coming out this afternoon. So please do keep in mind this is the data up to the 4th of October 2020, and I will give a quick verbal update at the end just as to the kind of the change in the position that people will see in the surveillance report being released later today. So the situation in Northamptonshire at the moment obviously is the same as other areas. It is increasing, and it's increasing at a significant rate. And those core messages really are that we're asking people to be really strict as to how they adhere to the current guidance, and also adhere to the recommendations that we're making locally because the position is escalating. And the rationale really for that as a headline is that, you know, COVID cases have doubled in the county in the week up to the 4th of October from the previous week. And obviously we've seen the pattern of transmission and the escalation and the rapid escalation in the north, and therefore we want to avoid getting ourselves into a position where we are escalated. So as we've moved on to the next slide, people will see obviously that we've provided links, as we always do, to the government guidance. People will know that we've now got 3 levels for escalation, local alert levels as they're called. At the moment, Northampton is in the medium level, and that is the level at which we need to remain. We have seen previously how cases can escalate locally, and we have managed to, you know, obviously get ourselves off of a Chief Medical Officer's watch list. So we need to really draw the public back into that space where they're taking those responsible actions so that we obviously bend the trend that we're starting to see locally. We move on to the slide 6, please. If we go on to the sort of the summary position, I think we'll get straight into the data here and then we'll come back to the messaging. So in the week up to the 4th of October, we had 417 cases. That takes the total since the beginning of the pandemic to over 5,500. You can see from the graph there that, you know, we had a significant surge when we had green core, and then we obviously managed to bend that trend. We've had a small fluctuation in the interim around the week ending the 7th of September, but then we really did manage to adhere to the rules, get tested, isolate, and see those numbers really fall. The last week's data up to the 4th of October is a significant jump. That is very, very concerning, and it is all of the boroughs and districts that have been affected. If we move on to the next slide, I think the other thing of note here is the fact that we've got both genders now being equally affected. Sorry, Cheryl, I know you're probably trying to move on to the next slide. And equally, although we can see that we've got that large number in the younger age group, in the 10 to 19 and then the sort of 20 to 29-year-olds, you can also see those numbers increasing in the older age groups, and in particular, the sort of 50 to 59 age group, which is quite likely to be associated with younger people and family and household mixing. And it's not just that we're seeing more cases within one household, we're seeing the pattern of cases and transmission between households. So although obviously the rule of 6 applies here at the moment, we would be urging people to consider, just because they can mix with another household, looking at this data, should they be? The next slide obviously shows this in the sort of stark reality. As I said, this is data that's nearly 2 weeks old now, and I will give you that more recent update at the end. But in the week up to the 4th of October, you can see here how cases have climbed. So the total number of cases, obviously, across each area, we still see our more densely populated areas being affected the most with our crude numbers, but 121 cases in Northampton alone. And those areas that have been less affected now starting to move up the ranks. So you can see East Northamptonshire there with 76 cases. But the stark reality is we've got a strip of red arrows there. Every single area has seen an increase in cases. If we go on to the next slide. So that comparison between areas that we do by making the population the same size, you can see here that we've got obviously a cumulative rate since the beginning, but the week's rate that we're comparing obviously is starting to climb up. You can see there East Northamptonshire 55.4, that's the first time it's ever really topped the charts. That's a significant increase on previous weeks. Again, Wellingborough, a small population, but when you compare that the same size population to the size population in Northampton, it actually has a higher rate. So although we may be lower than the England rate because of the significant spikes that we've seen in the north, we are following a very similar trend. We are approximately 3 weeks behind them, and that worries me deeply. If we go on to the next slide, again, this very easily illustrated graphically. So you can see that significant increase in England, and although we were slow to follow it the last few days, you can see there is a real tilt in the kind of angle of our escalation. So again, one of the things that we need to be aware of is that community transmission is the main driver here. Although we have more outbreaks, community transmission, house-to-hold transmission, transmission within households is the key driver here. Now, clearly, if we've got more cases in the county, if we move on to the next slide, we'll have more outbreaks. So you will see that the number of outbreaks in Northamptonshire has changed. We've got an increase in reported cases in the university, and 16 outbreaks overall, 4 in that last week up to the 5th. That again has increased in the last week quite significantly. We have still got good school attendance, which is key, and we need to balance off all of these risks here, trying to keep schools open, trying to keep businesses open, but we've got to do it in the safest way. And when we're not out and doing those things, should we be mixing elsewhere? If we go over the next few slides, obviously we know where the focus of these cases are. We've got our densely populated and more deprived areas still continuing sadly to be the focus of the number of cases. If we look at the outbreak data, you'll see here, so this is the current active outbreaks in the week up to the 5th of October, we had 21. That's increased significantly this week. 10 of those were in care homes, but 43 cases. So people can do the maths here. Although we've got 10 outbreaks where we did have 1 or 2 cases per outbreak, we're now starting to see a higher average number of cases within each outbreak. Again, we're very lucky to have that proactive screening in care homes. So these tend to be asymptomatic cases. We're able to get on top of them soon and early in the process. But those workplace outbreaks increasing again, and also the school and college outbreaks again. Clusters and exposures we continue to monitor and obviously work closely with our environmental health officers and our Public Health England to make sure that we give appropriate advice and keep an eye on where people are visiting that they may have been exposed. So that local contact tracing process, helping us identify where areas or settings may be or may exist where people have been exposed, so that again we can take proactive action. So we continue to work obviously with our EHOs, with Public Health England, with the Health and Safety Executive, with police to try and enforce these messages. We need people to understand what the driver is at the moment and take evasive action. We've done it before. We've had one of the few areas that has ended up on the Chief Medical Officer's watch list, not just with 1 area, but with 3, and we've managed to get them all off. And this really is a call to arms. So this is the reality as of the 4th of October. This week's data shows a startling increase again. So the data, just to give you the headlines, between the 5th and the 11th of October, we've had 701 cases. So a significant increase again on the 417 seen in this report. And that takes the rate per 100,000, over 100 cases per 100,000 in 2 of our boroughs and districts. So this is not, an anomaly. This is not a data issue, because we know that obviously there were some issues around getting cases allocated appropriately for follow-up through some IT anomalies with PHE. These cases are real. These cases are happening now. And we need to make sure that people understand the risk and take evasive action, particularly coming up to half term, and really consider, just because they can do certain things whilst we're in level 1, whether they actually should be.
Thank you very much, Lucy. I'm looking around the room to see if anyone's got any questions. Toby Sanders, I'll bring you in, sir. Hi, Toby.
Thank you, Chair. Just wanted to add to Lucy's local position update, really, in terms of context from a health perspective, just to give a flavour of where we currently are across the NHS. And particularly from an acute perspective, and the position Lucy's described in terms of increasing positive case numbers in the community is now starting to translate into increased impact and pressure within particularly the acute hospital sector locally at our 2 hospitals at Kettering and Northampton. Members will recall that for most of the summer period, we've seen a very low levels of activity, thankfully, presenting into our 2 acute hospitals. What we've seen over the last couple of weeks has been a doubling in terms of the number of patients who are COVID positive who are in our 2 acute hospitals. Those numbers remain relatively small and certainly, thankfully, much lower than they were during the initial sort of outbreak and lockdown period. But as we're here today on this conversation, we've around 24 patients today that are COVID positive within those 2 acute sites. And we've also started to see an impact in terms of a number of those patients requiring more intensive support through our intensive treatment units, the ITUs. And finally, sadly, starting to see some of those cases also translating through in terms of increased number of deaths that are COVID related within the 2 acute hospital sites. Again, just to emphasise, the numbers here are small at the moment, but to build on, I think the real key message from Lucy there around the importance about observing the measures and doing everything we can locally and working with our public to support this. From an NHS perspective, we saw an amazing response during the initial lockdown period in terms of protecting the NHS and supporting the capacity to respond when we need it. At the moment, we're doing everything we can to keep as many other services running in terms of routine treatments, in terms of cancer care, in terms of stroke care, in terms of heart attack care, and so on. But we are very conscious, as Lucy's described, that we're seeing that increased pressure coming through. And we know from other parts of this country and elsewhere internationally that 2 to 3 week time lag of expecting to see that follow through with more impact and more demand. So it really is, I think, a kind of a critical moment for us in the county in terms of that, again, kind of calling to arms and rallying around the support and the things we can all do individually and in our families and workplaces to support the county's effort on this. Thank you, Chair.
Thank you, Toby. And I think we would all echo those sentiments. Absolutely. It's a team effort. I've got Councillor Matt Golby, the leader of Northamptonshire County Council. Matt.
Thank you, Chair. And I just wanted to echo the points that you've just re-echoed there, Chair. Thank Lucy and Toby for their reports and comments. But I think we are at a critical point again. And Lucy said a couple of key words there. And I think she referenced the Northamptonshire getting itself off the watch list on 3 occasions. And I think there is that point where we now need that call to arms again to public and use half term, which is starting, the children break up a week today, as that real break point, but really get some strong messages out like we did previously. And I know Jonathan's on the call, who did a really, really good job from a Northampton perspective of fronting up that and getting that message across through all the different channels available to us. So I would really support that and acknowledge that balance between the economic impact and mental health on the wider public, and of course the big and vast pressures that can emerge on our health partners that are on the call. So we are at a critical point. I think now is a time that we can again start today to really ramp up those strong messages that we did get out there before, and the public of Northamptonshire responded really favourably. Thank you, Chair.
Thank you very much, Matt. I'm going to bring in Chris Lofts. Hi, Chris.
Thank you, Chair. Yes, one of the other things that struck me about the latest data is that if you compare the picture now to what we saw back in March, April, the infections were seen mainly as an urban issue and were concentrated on the centres of population. And I think what we're seeing now is that it's spreading further into the wider community, so that even those of us that live in the more rural areas, we're actually seeing an increase. So I think the all in it together message, I think needs to be re-emphasised, that this is something that is affecting all of our communities. Thank you, Chair.
Thank you very much, Chris. I'm going to move, that sort of moves us quite nicely into the next item, which is number 12, the new lockdown levels. And I come back to Lucy just to start the discussion on that. Thank you, Lucy.
I'm conscious, obviously, of time, but I'm sure everybody will be aware of the fact that the government has released 3 new local COVID alert levels, medium, high and very high. And obviously not having a low level reflects the fact that there is no area of the country at the moment that is not affected by this, and where people obviously are in a position to be complacent or not to be considering their responsibility and the risk that is posed to them by the current position. Obviously, national restrictions apply to us, and although I'm very pleased that actually Northampton has been put in the lower level, and that very much does reflect the hard work that has gone before. As I said, there is no room for complacency. This is something that Councillor Nunn has reinforced. But the bit that I really want to emphasise is the fact that whilst our numbers are increasing, there is that balance to be struck between the economic impact of being moved up a level and mental health impact of being moved up a level. But there's no reason why we can't take some of the good practice from other levels and apply it now, so that we can try and avoid being escalated. So as I said, we've got, as Matt has repeated, we've got a natural circuit breaker as such in half term coming up. And I would implore people, as I said, just because they can do certain things under these restrictions doesn't mean that they should. We've seen evidence of sleepovers and things like that creating outbreaks in schools. We know that socialising still is a key factor from a point of view of transmission amongst households. So where possible, can you think about the things that you're doing, think about the risk. And as I said, and Toby's outlined, the risk is not necessarily to the younger population. We're seeing the risk then translate into admissions and sadly into deaths in our more vulnerable populations. So we have a responsibility not just to protect ourselves, but each other.
Thank you very much, Lucy. I think you summed the position up very well there, and I think we all agree with you on this board, absolutely, to that approach. David Jones from Healthwatch. Hi, David.
Yes, thank you. Healthwatch obviously is here to speak for people who use health and social care services, which is, of course, everybody, but others of us also speaking for communities. And I'd just like to pay tribute to the consensual approach which we're adopting, and between officers and politicians of all parties in facing the real challenges which Lucy and others have mapped out. But we do face a real challenge. It is immediate, and if you look internationally, you can see that when numbers begin to go up, they then start increasing very, very rapidly. But all of us are fed up of this, and all of us want to be out of it. But there is a reality that there are the risks that have been said. So if Northamptonshire is able to come together collectively to recognise that we are there to support each other and work together, as this board has been doing across parties and across offices, we have an opportunity ourselves to keep us in a better position. So as an independent person in this group, I fully support the way that's going, and say that it is a moment now for us to take that responsibility and to do our best to keep the numbers down and to protect the hospitals. Numbers can go up so quickly, but if we are careful together, and responsible for each other, we can manage things and keep things better. And as somebody who has lost a friend already through COVID, I know that the dramatic impact of that is significant, and it's a real challenge to us, let alone the unemployment issues, which are equally important. So we've got to hear the message. Thank you very much, and thank you for the way that this is being held together.
Thank you very much, David. Again, we all agree with all those points. I've got a number of people. So I've got Jonathan Nunn, and then I have Angela Hillary, who would like to come in as well. Jonathan.
Yeah, thank you, Ian, and everybody. In full agreement with a lot of these comments. We have to be absolutely clear. If this trend continues, we will end up in the higher level. There is no doubt about that. That's a national trend, not just local. But if that continues, being in the higher level will be inevitable. As a consequence, really, we've just got to ask everybody to dig deep. We've got to do everything we possibly can, and that's the message we've got to get out there. I think the message is this: other places have sought to be put into higher levels. I don't think that's for us. I don't think we should actively seek to be upgraded to a high level. Actually, the real message here is every single resident and business and person within Northamptonshire, we've got to unite to seek not to go up another level. We've got to do everything we possibly can to make sure, because those are not, there should be no complacency around the lack of restrictions. Keep reading what level 2 and level 3 means as a reminder as to where we could be if we don't really knuckle down. Thank you, Ian.
Thank you, Jonathan. I think we all absolutely agree with that as well. It's almost like we want to start doing things as if we were up a level before we get to that level. I think I would absolutely agree with you on that. I've got Angela Hillary who would like to make a comment. Angela.
Thank you, Chair. And just to place my support for that consensus position, but also as people have suggested, the opportunity to act and anticipate the trend increase and to think about what we can do with that, whatever the levels. I think mental health has importantly been mentioned, so I'm really pleased that people are absolutely thinking about the mental health and well-being of our population, because as we know, this is clearly an area of concern and increasing demand. So I think, again, we've got an opportunity to work together in the way that we are across communities, and to work with ourselves as NHFT, as the Mental Health Trust, but with our local primary care and community colleagues to think about how we can do even more working together in the approach. So really endorse it. Thank you.
Thank you very much, Angela. I appreciate those comments. I'm going to move us on slightly now. Lucy, did you want to cover as quickly as you possibly can, and I don't mean that because we're under a bit of time pressure, testing update and contact tracing update, if you wouldn't mind, or we could leave it over for the next meeting depending on everyone's timings. Lucy, what are your thoughts?
I can give you literally a 3-sentence update. So
excellent, that sounds perfect.
Testing improving in most areas, not all boroughs and districts though, so let's get out there. If you've got symptoms, if you've been exposed, you need to get tested. This is how we got on top of it last time. Just to say, all of our testing centres have capacity, so please use it. And from a point of view of contact tracing, although we still have some challenges with the accuracy of data, the local contact tracing is going well. We're seeing a number of contacts identified for each case. And most importantly, we're also sending out text messages now to remind people how they access support if they need to self-isolate because they are indeed a case or a contact themselves. So additional support out there, details on both the County Council and Borough and District Council websites as to how to access that.
Thank you, Lucy. Very succinct. Brilliantly done, as always. Can we go to Claire Hughes for a quick comms update? Claire, are you there?
Yes, good morning, everybody. Yeah, I'll try and fly through this quickly because I am appreciative that you're short of time. Just a quick update. We continue to work closely and provide comms targeted at the schools and the University of Northampton and the parents of all children at school, of all school age groups, primary and secondary. We've done specific work, including banners at key points of drop-off and pick-up to remind people about social behaviour and also internal communications assets. We also are putting out specific messages to secondary school students to raise the importance of isolation if they're symptomatic of COVID. We've seen that emerging increases that's been spoken about today in the wider age range, including the 50 to 59-year-olds, and we're increasing our social media and our other comms to these groups. We're aware that there is COVID message fatigue, and as such, we're trying to introduce new and creative expressions to our messages. This includes all our channels, and we're sort of trying to change and swap our traffic signal messages while keeping them fresh but relevant, social media, and we're looking now at radio and out-of-home opportunities and implementing sort of new banner ads. We're continuing to increase our messaging daily to promote the COVID-19 testing through our social media. We issued a press statement yesterday giving information on the self-isolation payment available, and we're also continuing to reach out to local businesses, particularly sole traders and independent businesses, with leaflets via our people on the ground to give them and explain the support available. We're also looking to extend our communications into leaflets, I think as Lucy's mentioned, for people attending testing centres to explain how they can self-isolate effectively. And we're looking, as I say, to introduce some new radio adverts and look at how we can be a little bit more creative and attention grabbing. It is really important that we get these messages out. Now's the time to act and think about our own behaviour. Our messages are going to very much reflect that. Just because we can, do we really need to do this? We should think very carefully about that, and that's going to be the sole kind of driver of our message over the next few weeks. I think that's all. Thank you.
Thank you very much, Claire. And can I just reinforce our thanks to the comm team for all the sterling work that you've been doing over the last month since this has started. I think the work you've done has been incredible, and it has done an awful lot to spread the message amongst the people of Northamptonshire. So thank you from me, and I'm sure thank you from everyone here, because I'm afraid you will be much deployed again going forward as well. So I think thank you is due to you. So I'm going to come on now to the frequency of meetings, which I think is a sort of general discussion. We didn't have one last week. We've got a few dates in the diary for other meetings, but I'd be interested to hear what people think about the frequency. At the moment, once a week feels about right because of what's going on, but I'll be guided by anyone in the room if they want to make a comment on that at all. Phil Bignell.
Yeah, sorry, I had a question from Lucy before you started that, but you missed my hand. It was about testing, obviously the importance of testing at the moment. It's a two-part question. What's the typical time for turnaround of test results, and what is the lab capacity at the moment to enable that to be done? So two parts about testing.
I do apologise, Phil. I did miss
that's right.
And I missed a couple of others as well, for which I must apologise. So I will come to Lucy, and then I've got David Jones and Chris Stamber as well. Lucy.
So Phil, lab capacity not an issue. The last update I had was that they could service 90% of the national testing availability. Certainly has not impacted locally, I'm very pleased to say. As I said, one of the opportunities again to reinforce, therefore, you know, if you're symptomatic, even the mildest of symptoms, if you've been exposed, self-tested. From a point of view of turnaround, obviously the ambition still nationally is to have those tests turn around in 24 hours. I think the reality is around 48 at the moment. But yeah, obviously that will differ dependent on which lab that sample is sent to. But locally, the feedback that we're getting is the reality is around 48 hours.
Brilliant, thank you.
Thank you. Sorry about that again, Phil. Chris Stamber, you had your hand up as well. I was far too enthusiastic to end the meeting. Apologies. Over to you, Chris.
Well, maybe I was enthusiastic about the next item because I want to speak on frequency of meetings. So
oh, good.
Are we on that yet?
We are now, I think. We've segued lovely into that. Lovelily, it's not even a word. We've done very well getting into that. So yes, over to you, Chris.
Okay. This won't surprise you, Ian, because I messaged you on this. I wish we had met last week, given what happened with the spreadsheet fiasco, shall we call it, and the rise in numbers. And we could have been getting some messages out earlier had we done so. We didn't. That's in the past now. We must continue, I think, at the moment with weekly meetings. To go to something less frequent would be wrong right now. We can reconsider the frequency of meetings as and when figures start to come down, but that's not happened yet. So we need to continue with the current frequency, is my view.
Okay, but thank you for that, Chris. And I'm looking I presume everyone is okay with that option of carrying on weekly, unless otherwise. stated. Okay, so yes, we will try and keep them weekly, and I think we did learn a little lesson last week from trying to remove the meeting. Probably wasn't such a good idea, so we will keep them in. Which moves me on. Phil, did your Phil Bignall, your hand is still up? Oh no, Lucy, your hand is still up.
Mine was just really to advocate for what Chris is asking, which is the maintenance of weekly meetings. At the moment, the situation is changing so rapidly, but just to give Chris some assurance, despite the fact that this board didn't, we still obviously continued with the messaging, and actually it was just because you can doesn't mean you should. Messaging actually started last week off the back of the data. Thank you, Lucy, and that's worth reiterating. Also, we did circulate all the paperwork that we would normally issue at the meeting. So the board members were kept informed as to the numbers and things like that. It just, we didn't actually meet, but we will now, from now on, meet weekly. So that brings me neatly into the future meeting dates. So we've got the 22nd of October at 8:30 and the 29th of October at 3. I presume everyone is okay with that. Excellent. In which case I will close the meeting unless anyone's got any other business. Thank you very much for attending today. Thank you, Lucy, as always. Thank you for Claire. Thank you to Claire. Thank you for all the team. See you again next week.